Welcome to our training on grassroots legislative advocacy. At the time that we're publishing this video, we've just hit a record high number of co-sponsors of HR 676, which is the single-payer healthcare bill in the House. And not far from now, Bernie Sanders is going to introduce a single-payer bill in the Senate. But what we're finding is that a lot of our activists who are in districts where the legislator is not yet on board single-payer, they've started to hit a wall. They've showed up to town hall meetings. They've demanded that their legislators support single-payer health care. They've done office visits. They've called their office, and they're just getting no, or they're getting stonewalled, and they're wondering what comes next. And when the bill gets introduced in the Senate by Bernie Sanders, the last time Senator Sanders introduced a single-payer bill, there were 0 co-sponsors in the Senate. And that is because senators are much harder to move. Their districts are a lot larger. And the interests that are working against you are much more powerful when you're looking at Senate districts. So it's time to answer this question of what do we do next once you've hit that wall? And we're going to try and answer that question. And the answer, to give you a little preview, is to use grassroots power and leverage in a strategic way to move your legislator. Now, this is a very different model of lobbying and legislative advocacy than you'll get from like a lobbying handbook, which tends to be written by insiders who have different types of power, who have like insider power. It's going to be different from the suggestions you'll probably get from legislators, other legislators, as well as legislative aides, people who have sort of worked inside the system. And it's even different from approaches taken like the Indivisible Guide, which is becoming very popular these days. But we'll get more into those details later. Now, the goal of this training, what we hope that you're going to come out with at the end, is having all the tools that you need to develop a very strategic grassroots campaign that's going to let you move your legislator, even if they are not strongly inclined to support single-payer healthcare. This could actually be used for other issues as well. Or you may realize, and we're also going to help you walk through this in the training, that you simply don't have enough grassroots power to move the legislator who you've targeted. And if that's the case, it's time to go back to the drawing board and focus more on outreach work. This means base building, this means coalition building, building out your movement in that district. And there's no point banging your head against the wall with the same resources if they're just not enough to move this legislator. So we're going to do this training in 3 steps. And step number 1 is to score your legislators and to just pick one target, prioritize one legislator who we're going to follow through the rest of the training. Scoring your legislators basically involves just rating them on a scale of opposition all the way up to leadership. But more than just sort of measuring their level of support, each rating is going to be associated with a measurable act that your legislator can do and that you can ask them to do. So this is also going to inform your organizing because the goal is to move legislators from opposition to neutrality, to move them from neutrality to support, and then of course to move them from support up to leadership. But you have to know exactly what you're asking them to do for that to be an effective organizing campaign. Then once you've picked one priority target who you want to move, we're going to move on to step number 2. In this step, you're going to power map your legislators. Now, this is a very old organizing tool in which you basically map out the power relationships between you and all of your allies and the legislator that you're trying to move. This is going to include your opponents, people who are working against you, groups that are kind of neutral, allies who might not have been activated in your campaign, and all of the people that are closest to the legislator on this issue. This experiment of power mapping is going to decide who you need to win over onto your side to get on board the campaign to be able to win at the end. The third and final step is you're going to develop a campaign of escalating tactics. And this is really how you're going to move your legislator. You're going to start off with tactics that don't involve using a lot of the power you have, but they're also very easy to carry out. They're sort of low resource. And they're generally going to involve private communications with your legislator. So they're going to be emails, phone calls, maybe private office meetings. And then if that doesn't work, you're going to start using tactics that involve more and more use of power, applying more and more leverage on the legislator, imposing higher costs on him or her. But it's also going to require greater resources, larger coalitions, and deeper bases in the district. All right, let's go on to step 1.